Let me
Thank
just
you. It
grab
looks
the
like
screen, James,
okay.
before we get too ahead of ourselves here. Can you guys see that?
We see your desktop and the PowerPoint. So I guess if you start your presentation, your PowerPoint presentation, that's it.
Oh my goodness, fingers crossed here.
All right. Well, I'll leave it with you, Steve, to take us from here. So thanks everybody again for your patience and the sharing there. Steve, over to you.
Perfect. So again, apologies everyone for the technical difficulties, but I'm very pleased to be able to speak to you for the next little bit about return to sport and specifically focusing on Parasport and some guidance for that area. In terms of my background, so I work at CSIO and actively involved with a few of our Paralympic teams. So I just figured I'd show a picture of them. So you got the wheelchair curling team there at the bottom, silver medalists at this year's World Championships. And there we have the men and women's wheelchair basketball teams who won silver and gold respectively last year in Lima. And unfortunately, their summer plans were messed up a little bit this year. So in terms of the objectives for today, we're going to start by updating the status of COVID-19, both globally and at home. We'll talk about some of the latest evidence and guidelines for testing and mask rules right here in Ontario. We'll review the current Stage 2 framework, and we'll talk about the recently announced Stage 3 framework and specifically how it relates to return to sport. And we'll briefly touch on the COVID-19 risk assessment tool for sports, but I know many have already had exposure to that from previous discussions. And then finally, we'll talk about some of the literature related to high-risk groups for COVID-19, and in particular para-athletes. And we'll address the questions that were submitted for this talk. So globally, what's happening? Well, there's more than 13.5 million cases of COVID-19 as of yesterday. I think approximately 8 million of those had resolved, and there were over 800,000 deaths or somewhere thereabouts in total. When you look at the hotspots around the world, the Americas are certainly one of them. 50% of the cases currently around the world are coming from the Americas, and about 25% are from the United States. Here in Canada, we've had more than 108,000 cases of COVID so far, and as you can see from this diagram, the vast majority are in the provinces of Ontario and Quebec, and many of the other provinces and territories have not seen the same number of cases and community spread that we have here. In terms of current cases in Ontario, so the numbers are going down, as everyone knows. We had 102 cases yesterday, and that was an 8% decline from the previous day. As you can see over the past several days here on the right, the trend is in the right direction, and that's likely why we had the announcement on Monday about progression to a stage 3 in many areas in the province. When you break it down even further, you can see that there are certain areas within the province that are resulting in the greatest number of cases. So in particular, the Greater Toronto Area, Ottawa, Windsor are probably the areas in the province that are seeing the most number of cases. And many of the smaller communities certainly have had very few cases to date. So that can be used to reassure athletes and groups that are training in those areas. When we break it down by age, as you can see from this chart, no one is immune to getting affected by COVID-19. Certainly those under the age of 20 have a little bit of a lower risk. And this chart also talks about the mortality rate. So as you can see here, young people, those under the age of 40, there has been a total of 12 deaths so far during this pandemic here in Ontario. The vast majority of individuals that are impacted significantly are those of an older age and those in long-term care. So this is a graphic that you've all seen, likely through some of the guidance that's come out through SMAC. As you all know, coronavirus or COVID-19 is a novel form of coronavirus. It presents with symptoms similar to the flu. It can result in some severe complications, including pneumonia, severe respiratory distress, kidney failure, and even death. And one of the differences between COVID-19 and the common flu is the incubation period. So in COVID-19, that can be anywhere from 2 to 14 days, whereas the common flu, typically, it's in the range of 3 to 5 days. So what about testing here in Ontario? Currently in Ontario, essentially anyone that wants to can get a test. So testing is recommended for those that have symptoms of COVID-19, and we'll talk about those shortly. Individuals who do not have symptoms but are concerned that they may have been exposed can attend a testing center, and those that feel that they are at increased risk can also get tested. And you can go to the government website, you can look up the nearest assessment center to you, and you can even take a self-assessment, which I did this morning, and all is well. So the Public Health Ontario recommends that if you have at least one of the following symptoms or signs that we're going to talk about, you should get tested. Those symptoms are fever or a temperature of greater than 37.8, a new or worsening cough, shortness of breath, sore throat, difficulty swallowing, a new smell or taste disorder, nausea, vomiting, diarrhea or abdominal pain, and runny nose or nasal congestion that is not otherwise explained, for example, by something like seasonal allergies. For children, the elderly, and those with developmental disabilities, these atypical symptoms would also warrant testing. Unexplained fatigue, malaise or muscle aches, confusion, falls, functional decline, an exacerbation of the underlying condition, chills, headaches, an upper respiratory infection, conjunctivitis or red eyes, or an inflammatory vasculitis in children. And many of you have probably heard of COVID toes. So what signs do we look for if you have a documented pneumonia on X-ray, unexplained elevated heart rate, low blood pressure, unexplained low oxygen saturations, or kids that aren't feeding would also warrant testing. So what about individuals that are asymptomatic but have contacts with confirmed cases? So the recommendation is to get tested as soon as possible, and certainly within 14 days of exposure. If an athlete tests negative, they must still remain in quarantine for the 14 days from their last exposure. And the rationale for this is because 20 to 30% of the tests can have a false negative, which means they can come back as negative when the person may still have COVID. If an individual tests negative and then subsequently becomes symptomatic, they must be retested. So what is a close contact? Well, a close contact is someone that is within 2 meters of an infected person for at least 15 minutes, and that starts 2 days before the onset of symptoms or 2 days prior to a positive specimen collection for someone who never developed symptoms, until the point that that person is isolated. So what about resumption of training after you're diagnosed with COVID? Well, really, this is a nuanced question, so I think seeking appropriate medical clearance and guidance would be appropriate. In terms of no longer being infectious, you typically have to fall within one of the following two categories. You have to wait 14 days from symptom onset, or 14 days from when the swab was taken if persistently asymptomatic, provided that the athlete is afebrile, feeling well, symptoms improving for at least 72 hours, or having 2 consecutive negative tests at least 24 hours apart. So what about masks and face coverings? Well, there is no mandate currently at the provincial level. However, many municipalities are now passing their own bylaws that may require the use of face coverings indoors. And in Toronto, that was passed a few weeks ago. And if you go through these bylaws, what you'll find is there are several exclusions. So in the Toronto bylaw, for example, Section 2B suggests that, or states that the policy shall permit the temporary removal of a mask or face covering where necessary for the purpose of receiving services or while actively engaging in an athletic or fitness activity. So while it's allowed for sport, some institutions, some facilities may have their own policies. So I know, for example, at TPASC, where the wheelchair basketball team trains, I've had to provide a medical letter for all of the athletes that are currently training in order to allow them to remove their masks during training. In terms of up-to-date information, the SMAC advisory, which goes out every 2 weeks or as needed, is certainly a good resource for everyone to review. And it can be found in various locations, including CSIO's website under the Resource Hub. So let's move on to what's happening now. And I would just like to thank Dr. Kraft, who got to the legislation before me, and she was generous enough to share some of her slides in this regard. So where we are now is currently in phase 2, stage 2, and different parts of the province entered stage 2 at different points in time. That started back on June the 12th for 24 different public health units, and regions such as Toronto and Peel and Windsor joined about a couple weeks later. It was announced on Monday that as of July the 17th at 12:01 a.m., so less than 12 hours from now, all of the regions in Ontario, except those listed there, will be allowed to proceed to stage 3. So let's take a step back and review stage 2, which was discussed, I believe, in a talk by Dr. Richards a few weeks back. In stage 2, as stated under Ontario Regulation 263/20, with respect to indoor and outdoor sport and recreation, indoor facilities were closed unless they were being used for an NSO, a PSO, or a professional sports league. 2-meter distancing had to apply. Gathering limits were initially 5 and then bumped up to 10, and some businesses were excluded if there was distancing. No team sports were allowed, except for training. So no games, no scrimmages, no spectators. Locker rooms were closed. Equipment had to be cleaned between use. No equipment that could not be cleaned could be used, and pools had their own regulations. In terms of pools, there were no slides, diving boards, or climbing structures allowed. Distancing was required, cleaning was required, and locker rooms were allowed to be open and showers. So where are we now? Regulation 364/20. There's a link there for anyone that would like to actually read the full legislation. And as I mentioned, it applies as of midnight tonight. The gathering limits for those regions that are now entering stage 3 is going up. The indoor limit is now up to 50 as long as physical distancing can be maintained, and the outdoor limit is up to 100. And you can't double dip if you have both components to your space. Physical distancing must continue, except for individuals that fall within the same social circle of 10 people. And an easier read for those that are interested would be this document, which you can find online at that link, which is the framework for reopening of our province. So what's not allowed yet? Here's the list: water parks, overnight camps, saunas and steam rooms, and prolonged or deliberate contact while playing sports. So those are the key legal terms, I guess: prolonged or deliberate. So when you look at the regulations, section 2.8, it states that physical distance is required except if playing a team sport or as needed for personal training. So, interpretation of that, if you are playing a team sport, you can get within that 2 meters, or if you're in the gym, you're doing strength and conditioning, you could get assistance for spotting or other activities if required. The gathering limits continue at 50 for indoor areas, with exceptions to pools, rinks, and I guess tennis courts would be outdoors. You need to clean and disinfect the equipment between use. Washrooms and lockers are now open. Still no steam rooms or saunas. And things such as splash pads, whirlpools, wading pools, water slides may open. And my interpretation, even though it's not mentioned here, is that diving boards would fit within this category. So prolonged or deliberate contact is not required. And the framework document also suggests that team sports in which body contact between players is either an integral component of the sport or commonly occurs while engaged in the sport are not yet permitted unless there is an approach or modification that can occur to prevent prolonged or deliberate physical contact. So a little vague. Spectators are subject to gathering limits and physical distancing measures. And in terms of amateur and recreational sports leagues, they can resume. However, if the league itself has greater than 50 participants, they must be divided into groups of less than 50, and only those individuals can play with each other. So what does this mean for Paralympic sports? So my interpretation is as follows. With respect to stage 3, or those areas that are moving to stage 3. When I look at the list and I think, which sports have body contact, certainly the ones that come to mind for me would be judo, taekwondo, and hockey, prolonged or deliberate contact. And then the ones that are a little bit less clear for me are the sports that involve contact of equipment or wheelchairs, and that can include categories such as fencing, rugby, and basketball. So I think some clarity certainly is warranted in those areas. The other thing that's changed in the Stage 3 legislation is this section, which refers to teaching and instruction. So what this section states is that 2-meter distancing is required, except when necessary for teaching and instruction that cannot be effectively provided if physical distancing is maintained. So in the legislation itself, it refers to things such as music teachers and what have you, but certainly my interpretation of this would be that coaches who provide teaching and instruction would also receive an exemption to the 2-meter distancing rule when required. And gathering limits obviously must continue to be followed. All right, so let's move on to the COVID risk assessment tool for sport. And I'm just going to go over this quickly because I know it was part of a previous discussion that everyone had. If you would like to know where to download this, you can find it in many locations, including On the Podium and I believe our CSIO resource hub. And there's also a version of this for club sports, which is just slightly modified so you can choose the version that suits your needs. And the purpose of this tool is essentially to help guide and help allow for planning. It is not a permission tool in terms of resumption of sport. It just helps figure out the risk and figure out how to mitigate it. So this tool starts with 6 questions, and those questions are as follows. Will training be held in a region where there's documented local transmission of COVID-19 in the past 2 weeks? Will training be held in venues where multiple groups are attending? Will individuals be reallocating to an area and coming from an area where there's active spread? Will groups include high-risk individuals, such as coaches or athletes who are over the age of 65 or who have underlying health conditions? And is training itself considered to be at high risk? Is it contact sport? Is there indirect contact through training equipment, etc.? And will the training be held indoors? So your score, based upon this initial assessment, is stratified from 0 to 6, which is very high. There are then 47 different questions and mitigation measures that you go through the questionnaire, and those fall under, I believe, 8 categories. So staff knowledge, specific measures such as screening in advance upon arrival, temperature checks, not sharing equipment, etc., an emergency preparedness and response plan, isolation capacity. For instance, teams that may be at a camp, they need to have resources to isolate athletes should they require it. Stakeholders and partner coordination, logistical coordination with public health, and communicating risk, as well as awareness of guidelines. So when all is said and done, you're left with a final score. And depending upon where you start, you can mitigate to a certain level. So for instance, if you start as a low to moderate risk initial assessment, answer 3 out of 6 questions positively. If you do very well with your mitigation, you could get down to low risk. However, if you start at 4 or greater, there is no chance to get down to that low risk category. So hopefully I haven't bored everyone too much, but now I'd like to address some of the questions that were put forward in advance of the talk. So the first question was a biggie. How much greater is the risk in these populations, and is there any specific stats or information coming from national or international data? So this, in terms of this answer to this question, I think there are a lot of factors that have to be considered. Certainly, there's a concern that para-athletes may be at risk of more severe disease and may be in line with the elderly and those with other underlying health conditions. However, para-athletes are not a homogeneous group, and we can't really have a one-size-fits-all approach in terms of risk. For instance, if I was to give an example, a young individual or athlete with a congenital limb deficiency may have very low increased risk when it comes to COVID-19. However, perhaps an older individual with amputation who is more sedentary, who has some underlying development of cardiovascular disease may have an increased risk. So certainly athletes with more severe impairment, those with any immune deficits, and those with chronic conditions could be at increased risk. There are currently no studies that I could find in the literature which discuss the impact of COVID-19 specifically on para-athletes. And this is understandable. It's a new strain, and we really have very little data at this point. There also has been no evidence that I could find or that the IPC has found to date, which suggests that an athlete with a disability in general has a higher risk of contracting COVID-19. So certainly that information can be relayed to athletes that may have concerns in terms of resumption of training. Some also may argue that para-athletes may be protected. They may have been educated better. They may be more experienced than the general population with respect to things such as hand hygiene, cough etiquette, and general infection control practices. So in general, the IPC will recommend following medical guidance from the World Health Organization, national prevention guidelines, seeking medical advice when indicated, and going to public health should an athlete be symptomatic. So in terms of medical conditions themselves that may pose an increased risk of severe COVID-19 infection, the best resource that I could find that summarized everything in one location was the Center of Disease Control. So you can look up their website, and they've been updating this data based upon the research on a regular basis. And the latest update was in the end of June. And what they did is they broke it down into 3 categories. So the first category is the strongest and most consistent evidence. So that includes multiple small studies that lead to the same conclusion, or a strong association from one large study. Mixed evidence is basically multiple studies that come to different conclusions about risk. And limited evidence is consistent evidence from a very small number of studies. So if we look at the list, this is what we see. In terms of the strongest and most consistent evidence of conditions that can lead to adverse, more severe outcomes from COVID-19, that list includes serious heart conditions such as heart failure, coronary artery disease or cardiomyopathies, chronic kidney disease. So certainly COVID has been shown to lead to kidney failure in some individuals, obstructive lung disease, obesity with a body mass index of greater than 30. There was one study that was published out of New York which suggested that People who had a BMI of greater than 30 had a 1.8 times increased risk of ending up in the ICU. And if your BMI was greater than 35, your risk, that risk increased to 3.6 times of ending up in the intensive care unit. Sickle cell disease, which is disease of the red blood cells that can lead to coagulation issues. Organ transplant increases the risk, certainly. One study showed that in individuals who have a solid organ transplant, the risk of moderate to severe disease was above 70% of the total cases that were surveyed in that study. And then type 2 diabetes. So there are some large studies and multiple studies which show the risk of type 2 diabetes and severe COVID infection. I believe there was one study that came out of China which indicated that I believe 25% of the individuals that presented to hospital with severe infection were actually diabetics. There's mixed evidence for other medical conditions such as asthma, cerebral vascular disease or strokes, high blood pressure, pregnancy, smoking, and the use of medications that can dampen our immune system, such as corticosteroids or other immunosuppressive medications that may be used in conditions such as rheumatoid arthritis or lupus. There's limited evidence for increased risk associated with bone marrow transplants, HIV, other immune deficiencies, inherited metabolic disorders, neurologic conditions, liver disease, type 1 diabetes, etc. I couldn't find anything specific on spinal cord injury and increased risk of severe disease in COVID-19. However, logic suggests that if we have a condition which impacts the muscles of respiration, whether they be the diaphragm, the accessory muscles, the intercostal muscles, then certainly impaired respiratory function, in my opinion, would be a risk factor for a more severe or poor outcome from this condition. So spinal cord injury, chest and above, certainly would be increased risk in my books. There was a document that was put out a couple months ago, the HP Return to Sport Framework, and in that document they did specifically touch on some potential interventions for para-athletes, and those interventions included delaying a return to sport. So for instance, the wheelchair basketball team certainly was not the first team to resume sport at TPASC in Toronto. Training schedules that designated lower risk times. So one of the requests that wheelchair basketball had was to have access to the strength and conditioning facilities at the center in Toronto first thing in the morning, where the facility was less busy, and right after all the equipment had undergone a deep clean at the end of the day. Staff working off-site when possible, maintaining physical distancing, and exclusion of high-risk athletes or staff from the training environment. So perhaps starting with athletes that have a less level of impairment, that are of lower risk first, and then adding in athletes that have greater impairments in subsequent phases. Question number 2, how do we address athletes' fears of getting infected with COVID-19, especially when the athlete had health issues prior to COVID-19? So first things first, you want to listen to the athlete. You want to hear their concerns. Then you want to educate. You can share the information that there's no current evidence to suggest that an individual with an impairment has an increased risk of contracting COVID-19 than anyone else. You can direct that athlete to the sport medicine advisories that are put out every few weeks. You can share public health resources, and even an understanding of what's happening in their local environment can certainly help alleviate their concerns, especially if there's no community spread that's happening in their areas. You want to review the available evidence regarding high-risk groups, and I'm happy to share these slides with you. You can discuss your sports risk assessment and mitigation strategies and what you're doing to keep your athletes safe, and that can be very reassuring. And if it's a complex situation, I think suggesting a medical opinion or medical review would certainly be reasonable with the athlete's family physician, their treating specialist, or I'd certainly volunteer to speak to any athlete that had a concern. And at CSIO, we currently have virtual assessments that are available, and during the pandemic, those are funded through OHIP. So there is no need for an athlete to even leave their home to have a discussion with their physician about any concerns that they may have. But ultimately, it's a personal decision. The athlete has to be confident before they return to sport, and you need to support them as best as you can. All right, I believe this is the last question that we have. If an athlete requires assistance transferring to their sport chair, it is your recommendation that only family members or people within their bubble assist with transfers. If the assistance is limited to holding a sport chair steady, would you advise against it, even if both parties are wearing masks? Thank you for hosting. All right, so with transfers, I guess things have changed a little bit. So ideally, household contacts or persons within the athlete's social circle would be preferred in terms of getting within that 2-meter space. Regulated health professionals, so a team therapist, has also been exempt from that 2-meter rule, so they would be a good option. And if neither are available, I guess the key thing is take precautions. So have both the athlete and the helper wear a face covering or mask. You would need to clean your hands before and after the assistance with the transfer. And you also want to clean any touch points, such as the wheelchair, as well before and after. If available, you can use a lift to help transport athletes. You may also be able to modify transfer techniques. So if you did have to physically get in there and help the athlete, maybe a technique where you're not face to face and in very close proximity would be advisable. And you want to minimize the time in close contact. So certainly, as we heard, close contact would be 15 minutes of that close interaction, and there'll be very few transfers that would fall within that time requirement. So all in all, in my opinion, the risk from helping with the transfer, helping stabilize a chair for a few seconds would be extremely low, and dare I say negligible, with the appropriate precautions. So that's all I have. Happy to entertain any discussion and any questions that anyone in the group may have.
Great, thanks, Dr. Dilkus. Really appreciate that. We'll open it up to the chat box now. If you'd like to have a little look over there, if there's any questions you'd like to put to Steve, I'll give it a couple of minutes to see anything come through. It doesn't look like we have any questions for you, Dr. Steve. Oh, hang on, Nada. Please, Nada, if you prefer to open your microphone, then go ahead.
Hey, thanks for the great presentation. Yeah, I had a question. I'm calling on behalf of Fencing Ontario, and I had a question regarding the teaching and instruction post that you had regarding that if a teaching or instruction, teachers or instructors are allowed to break that 2-meter rule in order to perform their duties and job. Would that include sports? So would that mean a coach can instruct their athlete to do whatever they need to do? For me, it's the context of fencing, and hence be okay to break that 2-meter rule because they're an instructor?
So that's an excellent question. That's certainly something that I thought about and had a discussion with my colleagues at CSIO about. If you open the legislation, it provides some specific examples in terms of instructors. It talks about teachers. It talks about music, other. I don't know. I'm not sure if it was gymnastics or other types of instruction. So to me, I don't see a lot of difference between instruction for sport. I think the specific term they used was instruction for recreation. So to me, sport is part of a recreation or would fit within that category. So in my opinion, I would say that coaches would fall within that description. However, I'm not a lawyer, and certainly others may have a different interpretation. And perhaps you can request some guidance from the ministry in terms of what that actually means in your specific situation. Certainly, it's noted that you want to do that only when absolutely required for the instruction. So it's not just an opportunity to break that 2-meter rule at all times.
I see. Yeah, it's been quite the challenge to be honest with you, trying to communicate with the ministry or anybody in that department. It's almost like they don't really know. They can't really give a clear answer, so it's kind of like going around circles. So it's just
yeah. So certainly there's a few things in my interpretation that I would like clarified, and I know CSIO has some regular interactions with the ministry, and I think what I can do is any questions that are outstanding that we can't provide very clear guidance on, perhaps we can take those on your behalf and see if we can get some clarifications during some of our regular meetings that we do have with the ministry.
Please, because that would be really important, because as our athletes are training footwork and target training and keeping distance, the coaches also want to start providing some professional, one-on-one lessons, and they're having a hard time doing that, especially for some of the athletes that are, gunning for the Olympics. And we just want to know at one point, because Tokyo is, still coming, and we want to know when we could actually start training effectively. And strength, you can only do so much strength and conditioning. You gotta actually, you know what I'm trying to say?
I certainly hear you. And I guess another piece of information that I can share is we currently are looking at making a request to the ministry to receive an exemption for the 2-meter rule for individuals, high-performing athletes that are training for the Olympic or the Paralympic Games. That is currently in progress. So we hear your concern, and we're hoping that at least for the high performance group, those that have the potential to qualify for an Olympics or Paralympics, that perhaps we can get some movement from the ministry on that.
That'll be awesome. Thank you very much for your time.
Great. Thanks for your question there, Nada. Dr. Steve, question from Ryan Blair. What type of PPE would you recommend?
So that's a good question. So I guess it depends on the situation. So currently the guidance is face coverings, and there's not really a specific requirement for that. N95 masks would not be indicated for anyone that's outside of the healthcare setting. So I would say any type of face covering would be reasonable because really what you're trying to do is you're trying to minimize that spread of droplets when you are within the 2-meter space. So using one, if possible, during that close contact would be reasonable. Gloves are not necessarily indicated. I think washing hands very carefully, having appropriate cough etiquette would also be important, in cleaning surfaces, I think are the go-to strategies.
Great, thank you.
So I will mention that, in terms of preparation for training sites, if you are going to have a training site, you certainly want to be prepared should an athlete come down with symptoms. And under those circumstances, I think having gowns ordered, gloves, masks, and even a face shield would be reasonable, because droplets certainly can get into various membranes, and your eyes are one of them. And also, should an athlete become symptomatic, making sure that they have a mask on too would be the go-to recommendation. With respect to para-athletes, one thing that I'll note is some para-athletes in specific impairment classes may have increased risk for certain type of allergies. So certainly when I was advising Wheelchair Basketball Canada, I suggested not to have gloves with any type of latex in them, just to reduce that risk of any allergic response and individuals in our group that may have allergies in that area.
Excellent. We'll just give it another few seconds here, see if there's any further questions from the group. In the meantime, I'm wondering if Pip, you could flash up that slide that has the resources on it. Once again, for folks to capture some of the information on there, directing to the resource hub, previous sessions that we've held around legislation. Obviously, it's a dynamic situation, so it's much of that legislation has changed and will change in the coming weeks.
Thank you, James. Murray actually built the slide, so Murray, okay. I'm going to have you put that up there. In the meantime, there has been in the chat, if you scroll back up a couple, there is the actually that's Mercedes has put some link there as well, but so yes, Murray had the slide. And if you go to our CSIO website, we do have a resources section with many. Okay, Murray, sorry, another technical problem. Murray does not have that slide, but what it will do is point you to our website, Canadian Sport Institute Ontario.ca. There is a section called resources, and we have all of our webinars that we have done so far, the recordings, the PowerPoint, along with some articles from other disciplines at CSIO. So please head to our website and take a look. There we go, and it is on the screen for you there. So, yep, csiontario.ca. Those are our some of the resources you can find there amongst many others. So, James, I will pass it back to you.
Thanks, Pip. So again, I can't see the chat there, Pip, so if anything comes up, please let me know now that I'm sharing that screen there. But big thank you to Dr. Steve Dilkus for taking the time. I know it was a bit of a rough start there for you, Doctor, but we got there, and great presentation, and thanks for all the information that you've shared with the sector there. So I will, if there's no further questions, I will let Dr. Steve get back to his rounds. As you can tell, he's at the hospital in his scrubs. And again, thank you to you, and thank you to the participants for taking part today.
Thanks, everyone. Have a great day.
Thank you, everyone. I will stop the recording now.